Hi there. So in this session we will discuss about psychosexual development. Psychosexual development, this one. And you have to appreciate the thing that this beautiful concept has been given by Sigmund Freud. So actually this is a table of Sigmund Freud's stages of psychosexual development, right? This is a very important topic, and we will discuss this topic in our session, right? So basically he has described the psychosexual development stages in 5 stages, right? Oral, anal, phallic, latency, and genital. So these are your 5 psychosexual stages. So we will describe it one by one. So see, oral. So oral stage develops from birth to 1 year, right? So actually it is the as the name mentions itself, oral, right? So actually this is your development process, including your chewing, sucking, this type of movements, right? So key task is your weaning. Anyway, the important part or the question which is asked from this table is this one: what happens if the oral stage gets fixed? So in case of oral stages getting fixed, it results in obsessive eating, smoking, drinking, alcoholism. In short, we can say it leads to addiction, right? So oral stage fixation results in addiction. Remember this point, right? Yeah. Next stage is your anal stage, 2 to 3 years. It is the prime focus is your anus. Task, the milestone task or development task is your toilet training, right? But the important thing is your fixation. What happens if your anal stage gets fixed? It results in OCD, obsessive compulsive disorder, right? Similarly, your phallic stage, 4 to 5 years. So here focus is your genitals, task is your Oedipus Electra complex, and this is your gender role models, right? Where in Oedipus, as I discussed in your last session, so in Oedipus the son has feelings towards his mother, and in Electra the daughter has feelings towards her father, right? So these are your gender based, right? And this fixation results in intimate relationships difficulty. Latency, 6 to 12 years. There is no focus, but development task is your social interaction. Here there is no fixation as such. Genital stage, this occurs in puberty and later. Focus is your genitals, task is your intimate relationship productivity, and there is, if it gets fixed, there is low sexual interest, right? So the important ones I will give a mnemonic, right? To remember O equals to A equals to O, right? Remember this mnemonic, right? So what I'm trying to make you remember is that if oral stage gets fixed, it results in addiction. If anal stage gets fixed, it results in OCD, obsessive compulsive disorder. Very important question, don't forget it. I will write again for you, right? If oral stage gets fixed, it results in addiction. Fixation of oral stage results in addiction, right? If anal stage gets fixed, it results in OCD, obsessive compulsive disorder. So that we can remember as OAAO. So remember this one, very important topic, right? So I hope you understood the stages and the fixation results of Sigmund Freud's psychosexual development, right? So I hope you will not make any mistake from this topic.